Looks like it's time for us to go ahead and get started. Hello, everyone, and welcome to this month's Northwest ATTC webinar. I'm Jennifer Verbeck, and I'm your host for today. We're excited to have Maya Magarati and Angela Gaffney presenting for us today on centering Indigenous knowledge, culture, and communities, approaches to Indigenous evaluation and opioid overdose prevention programming. I have a couple of quick housekeeping things. First, if you have any questions for our presenters, please type them into the chat box at any time, and we'll try to answer as many of those as possible at the end of the presentation. You'll also be getting an email at the end of today's webinar that has a link to a survey in it. Please take that survey as it helps us make sure we're bringing you the content you're most interested in, and it helps us to continue offering free and low-cost events such as this one. That email will also have a link to download the slides from today and a link to our website where you'll be able to find a recording of the webinar, and that should be available later this afternoon. Additionally, we'll be sending everyone who attends this live webinar a certificate of attendance, and it takes us about a week to get those out. You don't need to do anything to get the certificate unless you're watching this in a group. If that's the case, please have someone in the group email us within a business day with the names and email addresses for everyone who wants a certificate. And our email address is up there on the slide. It's northwest@attcnetwork.org. Okay, and now on to our webinar. I'm pleased to introduce our speakers today. We have Dr. Maya Magarati, who is an acting assistant professor in the University of Washington Department of Psychiatry, and also serves as a core faculty member in 7 Directions, which is a Center for Indigenous Public Health. Maya also serves as a project lead on the Tribal Opioid Overdose Prevention Project. We also have Angela Gaffney, who is a senior research coordinator at 7 Directions. Angela helped develop an Indigenous Evaluation Toolkit, and she leads trainings and tribal health programs to implement evaluation approaches. And with that, I'll go ahead and turn it over to our presenters so they can expand on that introduction. Thank you so much for joining us today. We appreciate your time.
Thank you, Jennifer. I will start. Do you hear me? Yes. Okay. Hello, everybody. My name is Maya Magarati. I am Indigenous Magar from Nepal, which is the land of high mountains, melting glaciers, unfortunately, deep river gorges, and rich cultural heritage, very similar to here. As Jennifer mentioned, I serve as the project lead on the Tribal Opioid Overdose Prevention Program at 7 Directions. And I want to express my gratitude to the Northwest ATTC co-directors, Brian and Dana, and Jennifer and Meg and the whole team for this opportunity to share our works with you, to all of you who are here, and also to our funding partner, CDC. And later on, when Angie is going to talk about the evaluation, and Angie, please introduce yourself. So I'm going to continue. So Jennifer, I'm not able to move the slide.
Maya, you just need to click on the screen to take control.
I did. So it is moving. Okay, good. There. First, we want to recognize that at the University of Washington in Seattle, where 7 Directions is based, we learn, teach, and live on the ancestral homelands of the Coast Salish people. We have a responsibility to acknowledge the history of Indigenous land dispossession and to address current disparities resulting from past or ongoing harms. So we want to acknowledge that. And today our goals are to share with you, a variety of works we do serving tribal communities across the country. And we'll spotlight a couple of resources that you may find relevant within the Region 10 addiction community. And we'll provide you some examples of how we do that through our Indigenous Evaluation Toolkit work. So briefly, who are we? So 7 Directions, we are the first national public health institute in the United States who focus solely on improving Indigenous health and wellness. So I just moved my screen. So we are the first ones, but there are 2 new ones, regional ones, also in the country at the moment. And our mission is to advance American Indian and Alaska Native health and wellness. And this is important by honoring Indigenous knowledge, strengthening tribal and urban Indian public health systems, and cultivating innovation and collaborations. And our team is led by our native faculty, Dr. Myra Parker, who's in the picture, and a wonderful staff made up of both native members and allies. A lot of them are not in this picture, including myself. And we are also supported by, and we help our students learn from us. So we have students also working with us, which we really love. Now, to provide the context, as we all know, during COVID, while we're all dealing with COVID crisis, epidemic, the country was also dealing with opioid epidemic at the same time. So 2 epidemics were colliding, right? And as we all know in this group, death by fentanyl rose during the pandemic. And for us today, what I want to highlight to you is that when you look at fentanyl overdose deaths among young males who identify as males between the ages of 15 and 34, right? That's the very, very young, important, productive age. That's, when you look at that, the death rates, again, rose over the pandemic by 3 times at least. Not only that, it was the highest among American Indian and Alaska Native. This graph, this chart shows the same thing. The overdose deaths were highest among American Indian and Alaska Native. So we want to acknowledge at 7 Directions that when we talk about opioid substance use, addiction, treatment, prevention, we are always entering into a heavy conversation. And we always acknowledge that when we work with our partners. Now, the question to us in 7 Directions and to all of you here today is, how do we reverse the trends that I just shared with you, right? And for us at 7 Directions, there is only one thing, one very important message I want to give you, which is for us, based on our work, based on what we hear, is culture. Culture is medicine, culture gives, culture heals, culture supports, and culture protects. So that's one message, if anything, from today's webinar I would like to share with you. Now, American Indian and Alaska Native and other indigenous communities have endured, as we know, hundreds of years of settler colonialism, historical trauma, resulting from governmental policies, such as forced relocation, boarding school system, among others. And these have disrupted, indigenous cultural practices, spirituality perhaps, definitely disrupted ways of knowing, ways of taking care of each other, and things like that. But we also know that many indigenous communities are on the paths of rebuilding these connections. And indigenous cultural and traditional practices have supported indigenous communities in maintaining health. So bottom line, in other words, is that in the context of American Indian and Alaska Native communities, and when you talk about care coordination for prevention, treatment, and recovery, this includes designing a culturally responsive continuum of care where indigenous values incorporate cultural strengths, they honor tribal sovereignty, and offer key support to community members seeking treatment for, again, OUD and opioid overdose. So these are the things I wanted to acknowledge and share with you in terms of how we do our work at Seven Directions. Now, okay. So we published a booklet where we highlight 4 models of tribal promising practices, where highlighting and showcasing, approaches that these 4 tribes have been implementing in their communities. And what we found out that there are 3 domains of care coordination common among these promising practices, tribal promising practices. And those 3 domains are, number 1, indigenous-centered practice. What we mean by that is the programs they are creating to support the community members, make sure that the programs and services fit with the cultural practices and the values of the community. Number 2, the programs are designed in a way that relationships are centered, whether it's cross collaboration across sectors, or engaging with community stakeholders or leadership, things like that. So relationship is really important. And the 3rd domain of care coordination is that capacity development of the organization and of the workforce is prioritized. So 3 domains we identified. And the bottom line, the fundamental motivation and intention was to save and support lives and reduce opioid overdose. Now, you will hear from Angie later on how these domains are reflected in our evaluation work also. Here, I just wanted to share with you, within those promising practices, key partnerships were identified as necessary for tribal care coordination implementation. And these would be, community-based supports, support services, and providers. Now, with this background, I just want to share that within Seven Directions, we see our work as translation science. And within that, we provide technical assistance, Indigenous Evaluation Toolkits, community of practice gathering grounds, and we are also doing working in terms of indigenizing data approaches. And we are supported by CDC, Robert Johnson Foundation, NIDA, Bloomberg Foundation, etc. And on our website, these resources starting in 2019, when we start our work, are available to everybody. So how are we serving tribes and urban Indian communities? I already mentioned technical assistance, gathering grounds, evaluation, and the big one, I think an important, exciting one of them is this conference we are hosting in Minnesota at the end of this month. And the background in my Zoom is that conference logo. We're really excited. And we have already confirmed that 300 folks are going to be there. And later on, if we have time, we'll talk more about that. So with that, I will now pass over to Angie to talk about evaluation. So Meg, would you please hand over the power to Angie?
Thank you, Maya. And while you do that, I'll just introduce myself briefly. So my name is Angela Gaffney, and I am a senior research coordinator at Seven Directions. I am not Indigenous. I am one of the ally members of our team that Maya mentioned. I'm originally from Spokane, Washington, and then have been at the UW for undergrad, grad, and now I work here. So been in Seattle a lot of my life. And so it looks like I have control now. Let me advance. Okay, so as Maya mentioned at the beginning of this call, one of our goals for this webinar was to share with you or to highlight some of the resources that Seven Directions has that you might be interested in as addiction professionals. We're not entirely sure how many of you work with Indigenous communities, but if you're on this webinar, perhaps you have interest in that, in how to, and maybe some resources for working with Indigenous communities. And so we wanted to spotlight one of our resources that we think is especially useful and is relatively new and hot off the press, which is this Indigenous Evaluation Toolkit that we've produced. It was designed for tribal public health programs to use and to be able to kind of work through on their own. We also provide technical assistance to facilitate that. I think we'll start by first just introducing the concept of Indigenous evaluation. So this first portion is just intended to be informational, educational, to help you understand what we mean by Indigenous evaluation before getting into the resource that you might find useful when working in communities. So what is Indigenous evaluation? So I'm just going to read here that a working definition we've come up with is long relied upon use of Indigenous ways of knowing and deep community involvement when assessing or evaluating an effort's effectiveness or community impact. So it's not all that fancy or foreign of a concept. It's really just kind of a long relied upon use of assessing what's happening, what's working well, to understand how to do something better for your community at its most basic level. And so why has Seven Directions taken on and started to produce resources to promote Indigenous evaluation amongst tribal health programs? And how does this relate to addiction? So as Maya shared earlier, American Indian and Alaska Native communities have been disproportionately affected by the opioid epidemic, the double epidemic with COVID. And in the last several years, a lot of communities have started developing culturally grounded approaches to their opioid epidemic and how to address that, from prevention to treatment. And in doing so, they've identified that, we've got these really culturally based interventions or methods that we're doing, but yet we're still being asked often by funders to evaluate them using a Western framework. And so that there's sort of a mismatch there. So what we've heard from communities and what we believe is that kind of culturally grounded programming also requires culturally grounded evaluation to understand if and how it's working and how to improve it. In addition, just generally Western methods of evaluation can feel sometimes punitive, judgmental, funder-driven, rather than really focused on the needs of the community. An example is that, with a randomized control trial often needs a large sample size. It also needs a control group where people do not receive services that they're eligible for. And so a lot of Indigenous communities, maybe don't have the large enough sample to participate in that kind of an evaluation and thus can't get the funding to do something. Or B, don't want to deny services to half of their population just to be able to provide a control group. So that's an example of where there's a mismatch sometimes between funders and communities' evaluation goals. So for those of you who are familiar very broadly with Western evaluation, I thought this slide is intended to provide a bit of a compare and contrast. So both Western and Indigenous evaluation involve a systematic gathering of information about community services, needs, and outcomes. Both are, learning systems, but some key differences. So I'll read through the Western paradigm first and then go to Indigenous. Western evaluation often focuses on the objective information, what is measurable and knowable, and that someone can kind of come in and verify, an outsider could come in and verify. And that's often the role of the evaluator, is to kind of make sure the data that they're receiving is objectively verifiable. Often the questions being asked or addressed in an evaluation, in Western evaluation, can focus on a bigger picture finding, something that's relevant for the field or for the literature, and are driven by external validity. So thinking of, are these findings cogent and strong and relevant for a broader community to learn from. And they can also they can include community participation, but typically the ownership of the evaluation process is not as community driven. It's more owned by either one agency within the community, or really by a research firm who's come in and asked, hey, can we work with you to be a pilot site for something? So in contrast, Indigenous evaluation really emphasizes holistic knowledge types. So not just looking at what is objectively knowable, measurable by an outsider, but thinking of all types of Indigenous knowledge. And I'll talk about that a little bit more later. Feelings, spiritual relationships, etc. It also, Indigenous evaluation prioritizes addressing community-defined questions, things that are important to the community to ask, not thinking about how could we publish this or how these findings can contribute to the field. And then thirdly, on the who is involved, it's a deep community involvement and ownership, capacity building, getting local folks from the community involved in actual data collection. And then really, really strong emphasis on data sovereignty. So ownership of the data, again, not having a researcher come in, do some research and take that data, and then that's theirs on their spreadsheets and their storage system, but rather the data belongs to the people about whom it describes. So those are some broad stroke comparisons between Western and Indigenous evaluation. I want to emphasize that there is room for aspects of Western evaluation in Indigenous evaluation, but just again, trying to provide some broad stroke comparisons. So in 7 Directions' own Indigenous evaluation work, the toolkit I mentioned that I'll go into in a little bit, all draws very heavily from a very seminal foundational work by Joan LaFrance and Richard Nichols. It was created with the American Indian Higher Education Consortium. It's called the Indigenous Evaluation Framework. And they identified, I want to note, Indigenous evaluation is not unique to 7 Directions. It's a whole field. There are lots of people working on these on concepts, writing literature, and doing work around this. This is one resource that we really relied on because it's so seminal in the field in terms of compiling a lot of concepts and providing a framework. So the 4 foundations that the 2 authors there identify are the fact that Indigenous evaluation relies on cultural values, incorporates Indigenous ways of knowing, ensures community engagement, and uses metaphor. Some of the things I already said regarding Indigenous evaluation. And one other just key thing to note about Indigenous evaluation in contrast to Western is that it's really driven by values. So I'll talk through the 5 key values that LaFrance and Nichols identify, and then a little bit about what they mean. How does this apply to an evaluation? So the first one is Indigenous knowledge. That's a really strong value of Indigenous evaluation. And what that looks like then is below is honoring multiple ways of knowing and using the knowledge once gathered. So Indigenous knowledge prioritizes this moral responsibility to actually act on knowledge that's created or generated in an evaluation process, not to just put it in a journal article and on the shelf, but to actually act on it is a very strong value. Secondly, people of a place, that value sort of means focusing on what works for people in a given place, because no Indigenous community is the same as the other one, and also it needs to, what you're evaluating needs to work for the people that you focus on in that given place. So how this applies in an evaluation context is always including local context when telling an evaluation story, and just respecting that what works well in one place might not for another. So focus your evaluation again on that local context, worry less about external validity. The third big value is centering family and community. And how that kind of materializes in an evaluation process is focusing on a lot of community engagement in your evaluation and using participatory methods, and then also focusing on community level outcomes. So how does this intervention or this thing that we're evaluating affect the community's well-being as your key outcomes, rather than individual rates of obesity, morbidity reduction, those kinds of things. So next is honoring our gifts. This value relates to the idea that people have different starting points, and that we should come up with multiple ways to measure accomplishment, not just one in an evaluation context. And finally, respect for sovereignty. It gets back to a bit of that data sovereignty that I mentioned, so the tribal ownership of the data, as well as this goal of building evaluation capacity in your community, not just having an external evaluator. And finally, a big emphasis on reporting the findings to the community, sharing the data, sharing the findings interactively in the community. So we're still in this kind of conceptual foundation space. So another key piece that I kind of previewed a little before is that, so the two big differences with Indigenous evaluation are what kind of knowledge is used, who is involved. And in terms of what kind of knowledge is used, this is sort of an overview of the three types of Indigenous knowledge that we think about. So number one is empirical knowledge. This is things like observations and experiments in natural settings. Some examples of this might be weather, like how is the temperature today? That's an empirical observation, but it's not necessarily necessary to involve data on that. You can say warm, cold, etc. A plant's readiness to harvest. That's empirical data that Indigenous communities have been collecting for millennia, to understand their, agricultural systems, to understand the community's readiness to move on from a place. So the goal here in highlighting these types of Indigenous knowledge is to say that Indigenous communities have been collecting and using this knowledge since time immemorial. This is just sort of putting a categorization upon them. And the goal with Indigenous evaluation is to use all of these different types of knowledge, not just objective, measurable data, information system fields. So traditional knowledge, in contrast, is more of the kind of knowledge that's like handed down through generations and frames beliefs. So examples of that kind of knowledge that could be used in an evaluation context would be, as it says here, community origin stories or clan histories, agricultural knowledge, or elders' opinions about a program. That's something that you might be able to collect that provides traditional knowledge related to how an intervention or some kind of thing in your community is going, because they may tie their perceptions of it to an origin story or to some metaphor to provide that knowledge, that context about how the thing is going. And then finally, revealed knowledge. So this is one that it might be harder to provide some examples of myself as a non-Indigenous person, but as it's been explained to me through the LaFrance and Nichols framework, this involves dreams, visions, ceremony, and feelings. So these are the result of the spiritual senses that individuals and communities experience in moments of sacredness. So this could be used in an evaluation context to describe someone's feelings about a program, their own feelings of sacredness as it relates to being involved in a program, for example, or through art. So that's another way that one could get at this type of knowledge, and this type of knowledge could be used to evaluate a program. So, and thanks for the comments. Feel free to keep adding those. We'll review those at the end. One really important thing throughout all of Indigenous evaluation is data sovereignty. Key to note here that really stood out to me is that this refers to any data about community. So it's not just about a program, but it's any time anyone is trying to do to approach an evaluation with an Indigenous evaluation frame. There is a strong emphasis on getting community ownership, community approval for collecting any information about the community. That involves about their resources and environments, their individuals, or about any of their history, etc. So even just a picture, even just going to, for example, a reservation and taking a picture of the land is data. That's taking information out of that place, and it requires permission. So it's just something to keep in mind, and that we in the evaluation toolkit ask groups to keep in mind at all phases of evaluation. As Maya mentioned, this work is really not emotionally challenging. It's number one, it's acknowledging a lot of historical trauma and the fact that Indigenous knowledge was actively suppressed for so long. So working in the field of Indigenous knowledge or trying to work with the community to revitalize some, aspects of Indigenous knowledge that were not as present maybe or highlighted in evaluation before can bring up some really heavy topics. And so one other piece of evaluation, Indigenous evaluation, is holding space for communities to conduct ceremony, prayer, or other culturally appropriate activities in advance of doing this evaluation work, because it is such a heavy topic and it's going to really vary by community. So that's the portion of what I have to say that's just sort of conceptual foundations. And next I'm going to talk about this toolkit that we've developed and that some of you might find useful as a resource when working with your communities. So together with our partners from CDC and National Network of Public Health Institutes, we produced a toolkit, and it's an actual booklet. We have it if you ever need a physical copy, but we also have a downloadable PDF if you wanted to look at it, and we can put the link in the chat later. Or Maya, maybe you could put the link in the chat, please. And it's basically provides a step-by-step workbook that groups can work through to integrate Indigenous knowledge concepts, as just discussed, into an actual evaluation project. So we'll look at this a bit. Next. Not able to advance. Let's see. Jennifer, can you advance?
Sorry, I can advance, or if you just want to say next slide when you're ready.
Okay, sure. Next slide. That went back. There we go. I think we might have skipped one. Advance. And next slide. Okay, maybe this is it. So what the toolkit that we developed does is really tries to put those core cultural values that I mentioned from LaFrance and Nichols' framework, those 5 blocks there that you see, and turn them into an evaluation process that groups can work through. And it's here shown as like a circle. You might envision this as like a continuous process improvement circle or something. The idea being that Indigenous evaluation is cyclical. There's no beginning and end, that it involves continual reflection and designing and tweaking and then assessing and designing and tweaking and assessing. So that's the conceptual framework for the toolkit. Next slide. I want to note that, again, we didn't create this in a vacuum. This has been a concept that's been around for a long time, but we were compelled to create a toolkit for tribal public health programs, specifically tribal substance use prevention programs, out of a need identified from the community. So we started in 2020-21 by speaking with several of our tribal public health partners, talking to them about what their evaluation capacity was, what they needed, generally how evaluation was working for them. And what came out of those conversations was that there was a desire to change, to be able to use different methods, to not always have to do those, like I was saying, like an RCT or Western kind of evaluation standard, but to have some more information, more knowledge about how to do different methods. And so there was a call to create just some more step-by-step guidance around that. So we, over the next couple of years, worked on coming up with a framework for this and working with Joan LaFrance to work through her framework and see how could we maybe translate that. And then in 22, the last couple of years, we created this actual toolkit. We worked collaboratively with some tribal public health programs to actually pilot this. So to give us feedback through, what it was through Zoom, but basically we would talk through is this kind of language around how you might approach designing an intervention with an Indigenous way. Does this make sense? And they would provide great feedback around that, around the graphics in the toolkit, just everything. So we're really grateful to our partners who helped with that. And these are folks who are working on the ground in addiction programming in Indian country, providing that feedback. So that was great. And then I'll talk about our next steps at the very end. But that's how we kind of developed this process with community feedback. Next slide. And the toolkit itself, as a preview, if you were to pick this up, has that circle that I talked about. So continuous learning process. And then 10 steps. The 10 steps are broken up into 4 phases. I won't read through them all here, but you can kind of see how this is organized. And again, the goal of the toolkit is just to be really like step-by-step clear about what a group could do, a team could do to integrate Indigenous evaluation at every step of planning for and implementing an evaluation. Next slide. So I'm not going to go into all of the steps and what you could do if you do pick this up and work on it with a group or community or your own team. But some concrete things from it that I thought would be just kind of interesting to this group are some examples we provide of ways to both decolonize data collection methods, and also use Indigenous data collection methods. Those two words, I think, or phrases can get used somewhat interchangeably, but I do think there's a distinction. And as it's been explained to me by my Indigenous colleagues, decolonizing Western data collection methods is more about knowing that there are these data collection methods that researchers have used. And there is some value in those methods, but trying to strip away the power dynamic of researcher community, trying to like a focus group. A focus group is a perfectly like innocuous thing to do, but when done with the dynamic of outside researcher and then respondent community, that has a colonial kind of connotation. So decolonizing those methods is the idea is kind of stripping away the colonial aspect, the extractive aspect of the method. So some examples here are to only mindfully gather the information that is project essential versus just compiling all accessible data about a project. This kind of strips away that, again, that extractive and maximizing impulse that a researcher might have. If they can, the more data they can get, the better. Another method is to integrate tribal languages throughout all materials. This, just acknowledges that the English language, for example, is not the only language that things ought to be asked in. Additionally, adjusting instruments for different populations. It's fine to have a survey, but just make sure that the survey questions are relevant for elders, and maybe reduce the need to have things be 100% consistent for all respondents. Acknowledge that there's some room for differentiation. In terms of incentives, if some researchers go to community, give gift cards, ask what the meaning of gift giving is first before developing incentives into your plan, and ensure that the gifts are usable in local contexts. So don't give folks a Walmart gift card if the nearest Walmart is like 100 miles away. And then lastly, big time, involving tribal community members at all stages of a project's development who can ensure that sensitive knowledge is handled well, if it should be collected at all. So if an evaluation plan has some component where they want to have community history, origin stories and that some measure or some piece of the evaluation, making sure that's absolutely necessary before collecting that and sharing it. So these are just some ways to decolonize Western evaluation methods. Next and sort of last, I will share, next slide. I'll share some examples of Indigenous knowledge gathering activities. Same as knowledge gathering and data collection are kind of used interchangeably here. Indigenous knowledge gathering, in contrast to decolonizing, is use ways of collecting information that have always been used by Indigenous communities. So it's less focused on like, what are the Western researchers doing? How can we strip that down? And more just like, what are the ways of knowing that we've always used and learning that we've always used? And that one is, the first one is involving the community. That's always been something that Indigenous knowledge involves. But the other ones are, conversations, talking to people, asking their feelings about things. So for example, asking youth about their feelings of connectedness to adults with substance use disorder in their lives. Or inviting people in to share stories, storytelling being the big Indigenous knowledge collection method there. So inviting actual drug users in to speak about things and how maybe an intervention or just initiative in a community has changed their feelings. Using art-based activities to help people articulate their feelings. And then the last pieces here might seem a little bit objective and Western, but the purpose in mentioning them is that Indigenous knowledge has also included empirical knowledge since time immemorial. Indigenous communities keep records too, and Indigenous tribal epidemiology centers also, the data that they capture can be considered Indigenous knowledge too. We needn't exclude those sorts of objective data from what we think about as Indigenous data. So next slide. So I spoke for a while. I shared, conceptual foundations of Indigenous evaluation, and then what is in this toolkit that we've developed, and what you might get from it if you use it. So the next steps for us are basically that we've done a couple trainings with actual substance use programs in tribes over the last couple months that have been amazing. It's been so great to go out and actually go to the communities and conduct a 2-day training on these concepts and the toolkit, and work with them on an applied project. Like, how can they tweak their evaluation plan of a given project that they're working on? And so our goal over the next couple years is to, or I guess I should limit that over the next little while, is to continue trainings with different tribal public health programs and partners, just expanding the number of trainings that we do. We're also working on tailoring this toolkit to, other fields, other prevention fields. So not just opioid specific work, but other prevention work and other public health work. The concepts and the steps are all kind of similar, but the examples that we included in the toolkit were kind of opioid prevention specific. We're also hoping to involve implementation science a bit more in our process. And so by that, we mean just for ourselves, learning how and what aspects of our training and dissemination of this toolkit are working well, specifically, like being methodical about kind of trying to understand how that's working. And secondly, seeing how this whole project can contribute to the field of implementation science. What aspects of implementation science do or don't work well when thinking of work in Indigenous communities or with Indigenous evaluation. So, and then just ongoing reflection and refinement and trying to make this tool as useful as possible. So yeah, that's sort of where we're at with the toolkit. And I think it's been linked in the chat. And if anyone is interested in receiving, further training on this to work with a group who is, designing a program or thinking through how to evaluate a program, we would love to hear from you. So with that, I believe I'll pass it back to Maya to kind of wrap up our portion, and then we'll head over to Q&A. So next slide.
Thank you so much, Angie, for providing such an excellent overview of our Indigenous Evaluation Toolkit. And it looks like there's interest on the toolkit. So before we move on to the Q&A section of this webinar, I do want to briefly talk about another aspect of our work is bringing, designing or creating, developing, sustaining this community of practice, specifically community of tribal practitioners together, where we share knowledges and practices. And we have heard, not only last 5 years, but before too, how there is so much interest among different tribes to learn about programs that are working in other tribes, right? But as Andrew said in the beginning, these programs have not been published yet in the scientific literature, and sometimes not even in the gray literature. So they are not publicly available. So one of the things we try to do at Seven Directions is highlight, promote, and elevate those tribal programs. So in the end of this month, we are hosting our biennial conference, which we call Our Nations, Our Journeys. where we have invited keynote speakers working in the field of tribal public health, tribal data sovereignty, and tribal opioid epidemic, prevention, intervention, recovery, all of that, focusing on two things. One, healing from the opioid epidemic through strength-based approaches, and then data sovereignty. I have heard that in-person registration has been closed. However, virtual registration is still available and open, and we really invite you to participate, join us in those 3-day conference. If you are interested to see how we do our work, how we engage with our communities, tribal communities, and how we share knowledge with each other. With that, I will now pass it over to Meg and Jennifer.
Thank you, Maya and Angela. We really appreciate that. It was great information. I'm going to give people a couple minutes to hopefully type any questions that they might have into the chat box here and just do a couple of quick announcements. Please fill out our evaluation survey for today's webinar by clicking on the link in the email we'll be sending out later today. It's also posted up in the chat box. And then join us for our next webinar. We're still determining the date and the title for that, but we should have it up on our website within the next week or two. And we'll also be sending out an announcement in our newsletter for that. Let's see. Oh, it looks like somebody needs the link. It's probably not clickable in the PowerPoint slides. Oh, there we go. Perfect. Thank you, Angela.
Yeah, and I would add that if you click on that and navigate a little bit, you'll find the agenda, so you can kind of see what the sessions are. And yeah, if you're in the world of working, even if you don't work with tribal communities, but you're in the addiction world, there'll be some just super interesting presentations about what people are doing. And again, like Maya said, not always going to be something you could Google because people are just sharing stories, kind of thing.
Wonderful. Any other questions?
I see a comment. Joel says, I can't find the link for evaluation. Do you mean the session today's evaluation or our evaluation toolkit?
I'm going to post our evaluation again, just.
Oh, today's session. Okay.
There we go.
I would like to invite you all, if you're interested, we are always open for collaboration. We want to see how we can bring resources to our tribal community partners, public health programs, behavioral health programs. If there's any way, you are thinking of, hey, we may want to, maybe work with 7 Directions. We really welcome, that.
And I know you guys have the link to download it, but you said people can order copies of the toolkit as well. Is that something that they can just do through your website?
I don't think we have a formal physical copy ordering form, but if you would like some, please email. I'll put my email here. You can just email me. But to order the full toolkit, we have. If it's a big order, we might need to talk. But if you just need, a few, we can happily get them to you through just regular mail, kind of thing. And it looks like somebody said they'd love to register. Mark, thank you. That will be so good to see you there.
Any other questions? All right. Well, thank you so much, Angela and Maya, for your time today. We appreciate you spending time with us and going over this wonderful content. And thank you for our attendees today. We'll give you back a few minutes of your time.
Thank you so much.
Thank you, everyone.